Michael Jackson was an American singer, songwriter, and dancer who became one of the most influential and iconic figures in music history. Born in Gary, Indiana in 1958, he rose to fame as a member of the Jackson 5, a group formed with his siblings. Jackson began his solo career in the 1970s, and his album Thriller, released in 1982, became one of the best-selling albums of all time. Throughout his career, Jackson was known for his innovative music, dazzling stage performances, and unique fashion sense. He also faced controversy, including accusations of child molestation and struggles with his health and personal life. In 2009, Jackson was preparing for a series of comeback concerts in London when he suddenly died at the age of 50. His death was caused by a cardiac arrest that was later attributed to acute propofol and benzodiazepine intoxication. His death sent shockwaves throughout the world, and his influence on music and pop culture remains significant to this day. Despite the controversies surrounding his life, Michael Jackson's contributions to music and dance have left a lasting impact on the industry. He was a pioneer of music videos, dance styles, and vocal techniques, and his influence can be seen in the work of many artists who followed in his footsteps. His legacy continues to inspire and entertain millions of fans around the world.
Michael Jackson, the King of Pop, passed away on June 25, 2009, at the age of 50. His death was a shock to the world and sparked numerous speculations and controversies. The official cause of Jackson's death was acute propofol and benzodiazepine intoxication. Propofol is a powerful sedative used to induce and maintain anesthesia during surgeries, and benzodiazepines are a class of drugs used to treat anxiety and insomnia. Jackson's personal physician, Dr. Conrad Murray, had administered these drugs to him as part of his treatment for insomnia. Dr. Conrad was later convicted for involuntary manslaughter in 2011. The toxicology report showed that the levels of propofol in Jackson's blood were significantly higher than the therapeutic levels used in surgical procedures. The report also indicated the presence of other drugs in Jackson's system, including the painkiller lidocaine, the antidepressant doxepin, and the anti-anxiety drug lorazepam. The use of propofol for insomnia treatment was highly controversial and considered off-label, meaning it was not an approved use by the U.S. Food and Drug Administration. Murray had admitted to administering propofol to Jackson and was later found guilty of involuntary manslaughter. The tragic death of Michael Jackson highlighted the dangers of drug abuse and the importance of responsible prescription and use of medication. Jackson's case also shed light on the issue of off-label drug use and the potential risks associated with it. Toxicity is a significant concern when it comes to drug use, and it refers to the degree to which a substance can cause harm to a living organism. In the case of Michael Jackson, the toxicity of the drugs administered to him resulted in his untimely death. It is crucial to understand the risks associated with drug use and to seek professional help when dealing with any health-related issues. The tragedy of Michael Jackson's death serves as a reminder of the importance of responsible drug use and the need for caution when using medications.
So what exactly is drug toxicity? Drug toxicity occurs when a drug or medication accumulates in the body to a level that exceeds its therapeutic dose, leading to adverse effects on the body. The severity of drug toxicity can range from mild symptoms to life-threatening conditions. When a drug reaches toxic levels in the body, it can affect various organs and systems, leading to a wide range of symptoms. Here are some of the effects of drug toxicity on the body. Gastrointestinal system. Many drugs can cause nausea, vomiting, and diarrhea, which can lead to dehydration and electrolyte imbalances. Cardiovascular system. Some drugs can cause heart palpitations, irregular heartbeats, and changes in blood pressure. Central nervous system. Many drugs can cause dizziness, confusion, seizures, and loss of consciousness. Liver and kidneys. The liver and kidneys are responsible for metabolizing and eliminating drugs from the body. When drugs accumulate in these organs, it can lead to liver and kidney damage, and in severe cases, organ failure. Respiratory system. Some drugs can cause respiratory depression, which can lead to difficulty breathing or even respiratory arrest. In severe cases of drug toxicity, the effects can be life-threatening, leading to coma, seizures, and even death. It is essential to seek medical attention immediately if you suspect drug toxicity to prevent further complications. Managing drug toxicity at home can be a challenging task, and it is essential to seek medical attention immediately. However, there are some steps you can take at home to manage the symptoms of drug toxicity before getting medical help. Here are some things you can do. Stop taking the medication immediately. If you suspect that the medication is causing toxicity, stop taking it immediately. Do not continue taking the medication even if you feel that stopping the medication may make the symptoms worse. Call your healthcare provider. Contact your healthcare provider as soon as possible and let them know about your symptoms. They will give you advice on what to do next and may advise you to come to the hospital or seek medical attention. Drink plenty of water. Drinking water can help flush out the toxins from your system. It can also help prevent dehydration, which can worsen some symptoms. Monitor your symptoms. Keep a close eye on your symptoms and monitor any changes. This information will be helpful when you speak with your healthcare provider. Seek emergency medical attention. If you experience severe symptoms such as difficulty breathing, loss of consciousness, or seizures, call emergency medical services immediately. Always keep medications locked away and out of the reach of children. Remember, drug toxicity can be a serious condition, and it is essential to seek medical attention as soon as possible. Do not attempt to manage it on your own.
Preventing drug toxicity is crucial to ensure the safe and effective use of medications. Here are some tips to help prevent drug toxicity. Follow dosage instructions. Always follow the prescribed dosage and instructions for your medication. Do not take more than the recommended dose, and do not take medications more frequently than prescribed. Know your medications. Be aware of the medications you are taking, their potential side effects, and interactions with other medications, including over-the-counter medications and supplements. Discuss any concerns with your healthcare provider or pharmacist. Avoid alcohol and other substances. Avoid drinking alcohol or taking other substances that can interact with your medications, such as recreational drugs or herbal supplements. Store medications properly. Store medications in a cool, dry place, away from direct sunlight, and out of reach of children and pets. Use caution with new medications. When starting a new medication, pay close attention to any changes in your body and report any unusual symptoms to your healthcare provider. Regularly review medications with your healthcare provider. Schedule regular appointments with your healthcare provider to review your medications and make any necessary adjustments. By taking these steps, you can help reduce your risk of drug toxicity and ensure that your medications are safe and effective. You can get more information on BeMedWise website. Bye and see you next week. Please do like and subscribe.